We're here at the Royal Women's Hospital in Melbourne, the latest grand round on women in medicine, and I have here quite a good generational view here. First, Associate Professor Julian Rait, you're the President of the AMA in Victoria.
That's correct.
What's your interest in being here today, and what are you looking to come out of it?
Well, I think we're very concerned about gender equity issues in medicine. We've done a number of surveys of our doctors in training and also our students and found that really there is widespread disadvantage for women who are trying to seek particularly leadership positions in medicine, and also for those that are trying to get research grants. So we think that time has come to actually make some stands and some initiatives to try and change that. As far as AMA Victoria is concerned, we've actually got a draft constitution which we'll be putting to members in May that actually enshrines a gender quota on our board. So we think these sorts of structural changes are necessary, not just in our own board, but also across the health sector to try and enfranchise women and give them greater opportunities.
How is your board at the moment? What is the makeup?
Well, we at the moment we have 11 board members and we only have 3 women. And what we would like to do is to increase that to 40%. So we've actually mandated a 40% quota so that we can fill those positions and make sure that that percentage is maintained, which, by the way, reflects the demographics of our membership.
We talked, and I take completely that you're not really responsible for the AMA in New South Wales, but that's become an election issue there. In what way?
Well, as I understand it, that there has been some concerns about particularly the role of women in obviously in politics, but equally it's true in the health service as well. And so what the debate is there is that really that AMA in New South Wales is concerned, like we are in Victoria, to make sure that women are properly acknowledged and promoted in accordance with merit, not on the basis of gender discrimination.
Thanks very much. Now, you very kindly have brought your daughter, Louise, here, and you're a med student.
Yes,
so
that's correct.
Can you say where you're up to?
So I'm in my 3rd year at Melbourne University studying medicine. And I think events like this have made me really optimistic about the future of women's medicine. It's definitely one of those things you hear about all the time, discrimination and gender equity issues, and I think it's a very exciting time to be a medical student, and it's an exciting time to be entering this profession as well.
Were you conscious of that pathway, that it is, you are going to hit a ceiling at various points along the way?
I think as a female, you're conscious of that pathway, regardless of what field you're in. I think Dad has definitely tried to make me aware of that, while I've been making decisions. As early as year 10, we were making career-based decisions, and I'm just really pleased to see that these kinds of events are taking place to shape and change the way that we think about medicine.
Fantastic. Thank you for letting us just sort of jump upon you.
That's all right.
And what are you hoping that medicine will hold for your daughter that you have not been able to see in your journey through?
Well, I think that what I've been concerned about is really the institutional barriers to women progressing. There are all these roadblocks that are put up in front of women that aren't in front of men. And it's almost like they have to jump higher and faster than men in order to get the same roles. And so, interestingly, this morning I was actually with a police commissioner, a female police commissioner, one of the assistant commissioners, who was explaining to me exactly how Victoria Police has changed their culture. And so people may not be aware that in Victoria, both the police and the ambulance service have actually tried deliberately to consider women more broadly in their leadership. And I can say without any shadow of a doubt, I think that's really a great benefit to Victoria Police and a great credit to them that they've been able to do that. And I think that really they've, as it were, set the standard for the health service and for medicine to actually embrace the same values and also embrace the same positive approach, including quotas where necessary, to make sure that women aren't kind of marginalised and disadvantaged in their career paths.
Was there a moment for you where you realised you had to step up?
Look, I think it's been a series of moments. I think probably, the actual moment that really sort of moved me to change was I was looking into the face of a young physician trainee, a woman who'd been sexually harassed by one of their supervisors. And I realised at that point that this just couldn't continue. I just sort of realised that at that point that we'd really not done enough to help women, in particular in the training programs, to address this institutionalised discrimination. And So that was the moment that I really got fired up about it, I think, because I really felt that unless we really changed and made dramatic changes to the way we consider women and their positions in the profession, I think it's going to really disenfranchise a group that would otherwise be able to contribute immeasurably to how we care for our patients.
Thank you very much for your time before the event today.